Before the official ceremony announcing the recipient of the Pap Corps Endowed Professorship in Leukemia, we enjoyed an informal interview with Dr. Swords and his colleagues.
One of the biggest developments, I think, in the area of leukemia is this idea of targeted treatments. Okay, so the idea that leukemia cells rely on abnormalities to grow and survive. If you can identify those targets and build drugs to attack those targets and kill the cell, then targeted therapies eliminate the leukemia but spare the body's normal cells.
It can translate over into better treatments for other cancers, what you learn in
Absolutely.
the precision therapies that you're designing?
The technology that we have to investigate cancer cells has developed now as it was. And so we've, in the last 5 to 10 years, learned a huge amount about how cancer cells work and therefore, designing better treatments to eliminate them.
So it's designer treatment.
Yeah,
kind of like designer shoes.
Like personalized
It's personalized medicine.
Okay.
So the idea that leukemia is one disease is very clear to us when we use this sophisticated technology. We can see the disease is incredibly diverse, and so you can't take a one-size-fits-all approach. You got to have a personalized approach to rehabilitation. It's the next new horizon in cancer medicine, and it has hopefully the same impact as antibiotics did in the last century.
Exactly.
So this is hopefully going to be page-turning.
This is the first designated endowed chair that the Pap Corps has done. And just from talking to you and talking to Dr. I'm going to call you Dr. Arthur, there is so much out there that is coming up that is going to help. It's just amazing. And I know Joanne, I know everyone of the Pap Corps members are just delighted that you are the first recipient to receive this endowed professorship. And I know we're going to hear great things from you today.
Well, absolutely. So stem cells are immature primitive cells that can develop ultimately into your body's organs. And there's been huge breakthroughs in stem cells. We rely on stem cells. So first we eliminate the cancer and use stem cells to regenerate a brand new bone marrow. We're also using stem cells to repair organs. So if someone has a massive heart attack, we can use stem cells to repair stem cells. It's the next new horizon in cancer medicine, and it has hopefully the same impact as antibiotics did in the last century.
Exactly.
So this is hopefully going to be page-turning stuff.
So as we move into these new levels of research of personalized medicine, what can patients expect in the next 10 years?
What patients can expect is hopefully fewer side effects, more effective treatments, live longer even if the disease is incurable. Those are the bottom lines. And we achieve that by the realization, which has been there for a long time, that one size does not fit all and cancer is not one disease. But now we actually have specific targets that we are identifying on cancer cells that can be targeted. And for those cells that don't have any specific targeted therapy, the field of immunotherapy is exploding now to at least harness the immune system to attack the cells that look, quote, different or funny looking, rather than having a specific target.
So it's almost a two-pronged approach. You've got your targeted therapies where you create the drug the stem cells, and then the other side where you're teaching the body how to fight off its own invaders. Did I say that right?
Yes, invaders, wolves in sheep's clothing that are in the body to unrip their clothes to attack the immune system.
You got it. Is there anything that you could say that will help us communicate how important experimental therapeutics is as a research investment? Because that's where all the exciting things seem to be happening, but it's hard to describe to people what it is.
The only way we're going to develop better cancer treatments is to do clinical trials of better drugs. That's the bottom line. And a lot of people have misconceptions about clinical trials and people feel like guinea pigs, but the reality is that many of the treatments that we use today came through the clinical trial process. And And so we're big advocates for clinical trials in Sylvester. And for every patient we see that comes through the door with cancer diagnosis, our first thought is to identify a clinical trial. Because patients get best care on a clinical trial.
And that's why Sylvester is so important to South Florida.
That's right. And if I may add, I think it's also a big effort to make it the research that's done in the lab translate into a clinical setting, and also vice versa, learn from the clinic and take it back to the research and develop better approaches to cancer treatment, develop new biomarkers for the disease and predictive markers and so forth. So I think this is a very big commitment on the part of the Sylvester Institute.
I agree with everything that's said. I think in addition, I agree that we need to get better at identifying those targets within the cancer cell to go after and to treat, as opposed to just giving the body a chemotherapy or a poison. We need to be more directed. One other extremely high interest of mine, though, is we're getting better at treating cancer, but we need to get much better at preventing cancer. So in addition, at the Cancer Center, we not only need to better treat our patients with cancer, but we need to learn much more about who's going to get cancer and different prevention strategies to implement for those patients for risk reduction, whether it be risk reduction surgery, risk reduction chemotherapy, hormonal therapy. And we are working on, again, in research, clinical research protocols, in offering that to not only our patients but our community in order to better identify those women and men who are likely to get cancer and to implement risk reduction strategies so they don't even become a cancer patient.
And that's one of the major programs with the cancer prevention and survivorship, control and survivorship, and the outreach work that Dr. Koblitz is doing. And that helps bring what's going on in the lab out into the community.
Exactly. That and Dr. Slomovitz is also starting a high-risk screening program in Deerfield, which is very pertinent to Pap Corps. Most of the chapters are up here. So we really commend his efforts early on. He has focused his attention on not just prevention but high-risk screening.